7 years at dentistry, 2 degrees, and one massive change of direction. My guest today started out in pharmacy, a science degree at Manchester, and finished in 2020. She was safe, sensible, and sorted, and then she walked away from it.
I got in through clearing into University of Manchester, and as soon as I started, I was just like, this isn't for me. It's not the career I want.
She went back to square one and applied to a dental school. And now she's an associate in Bolton, building something most young dentists don't think about until it's too late. Not a practice, but a name. Because here's the thing we're getting into today: patients don't fall in love with the building, they fall in love with a person. The question really is, how do you build that at this sort of early stage? And was throwing away a safe career the smartest thing she ever did? Dr. Dahlia, welcome to Between Patients.
Hiya, thank you. Happy to be here.
Absolutely, absolutely, Dahlia. Pleasure is all mine. So, Dahlia, take me right back. You were doing, pharmaceutical science at Manchester. When did the hang on, I don't want to do this, this feeling, first showed up?
So it was literally during my first week of pharmacy. So unfortunately, I missed out on my A-level grades to get into dentistry, and everyone around me just said pharmacy is the next best thing. So I got in through clearing into University of Manchester, and as soon as I started, I was just like, this isn't for me. It's not the career I want. I went to my academic advisor and I told him, look, I want to switch to dentistry. Please, can you do that for me? And he said no, because obviously I missed out on the grades. So I stuck with it. I stuck with it for the first year, and then starting with my second year, I found out about graduate entry dentistry. So there's only 3 unis in the UK, I believe, that offer it. And I said to him, I was like, look, this is what I want to do. I'm going to apply for this. So during my third year, I resat the UK CAT, I redid my personal statement, reapplied, and alhamdulillah, I got in and started in 2020 to do my dental degree.
Absolutely. That's good to know. Alhamdulillah. So, why dentistry though? I mean, we've got 102 different industries. Why dentistry? Why this specific niche?
I think from a really young age, I really enjoyed art. I really enjoyed working with my hands. And me and my mum sat down, at a young age, and she was like, what do you want to do? And I was like, I don't know. I loved science, I loved art. So she started pitching the idea of being a dentist. And I grew up in Qatar, so I used to live over there, and we had a couple of friends who were dentists, and they let me go and watch, they let me shadow for a little bit, and I really enjoyed the workflow and the environment. And then that's kind of when I decided, okay, this is what I want to do. And yeah, that still stands to this day.
Okay, interesting. That's an interesting take. So, be honest with me over here. So, when you told people that you're switching from pharmaceutical to dentistry, what did they actually say?
A lot of people were against the idea, and I think it was more against the idea that pharmacy is pitched as an easier job. So you're just like behind a desk, you're doing medications, it's an easier lifestyle for a woman. From an Arab background, that's what a lot of people said to me. And they were like, in dentistry, you're going to be stressed, you're going to have a harder life, this, that, and the other. But I that's what I wanted. So I just changed. I was like, look, I'm going to do it either way. So I know it's another 4 years at uni. I know it's going to take, a lot longer to start a career, but it's what I wanted to do. So it's what I did.
All right. Wow. That's interesting. So, you already did a full degree, then you're signing up for around 3 to 4 more years. So, how did you make peace with that? The time, the money, all of it.
I think, it was hard, but I just thought it's like short-term pain for long-term gain. Once you've done your fourth year and your pre-reg year, in theory, it was only 2 years extra to switch degrees and do, first year to fourth year. So I thought it wasn't really that much more time. I know it's, going back to uni and doing a whole other degree, it seems like a really daunting experience, but it actually went really fast. And like I said, in the long term, it's what I actually wanted to do. So I thought it's a no-brainer.
Absolutely. So, this is something that's really important. Is the end output that you really don't know you're really going to get for the long run is something that you should be going after for, because individual that should be a long-term horse rider rather than a short-term player. I believe this is something that's really important for everyone listening or watching out there, is play long-term games, because the output you're going to be expecting from that is going to be much bigger than the short-term games that you typically tend to play. Interesting. So, you were doing the second degree, and did you ever even think for a second that you've made a mistake?
No, not once did I ever think that I made a mistake. It was my first phantom head session, and I was sat there, and I was, they give you this little cardboard to drill into, and I just thought like, this is it. Like, I'm so happy. I was so content with the decision I'd made, and I was like, yeah, I'm happy.
Wow, that's good. So it was just one, I'd say, not small decision, but definitely, you were about to spend another 3 to 4 years at uni as well, but definitely a decision that made you, reap the fruits of the future. So 7 years at uni, all in, what's like that, when your friends, your mates are earning and settling down, and you're still a student?
It is difficult because obviously, you're financially struggling a little bit. I was working 3 jobs to fund my second degree essentially.
Okay.
But
Wow.
it's just you've always got to have that end goal, in sight. And you just got to know it's only temporary. You're doing this for yourself, to better yourself, to give yourself a better future. Like, you've just got to have all these things in the back of your head. Now, we're in the same position as my friends. We're all working now. It's just temporary.
So you mentioned 3 jobs to fund your dentistry degree. You did about 3 jobs. I'm pretty sure they were part time. So
Yeah.
walk me through that. How exactly your typical day uh, used to look like? So you were studying, you were doing 3 different jobs. What was that?
It was a lot. It was a lot of stress. It was very tiring. I mean, I worked at 2 coffee shops, and I also tutored GCSE and A-level sciences and maths.
Hmm.
So on days I had clinic, obviously I'd go into clinic, come home, I'd tutor for the evening. On days I had off, I'd go to either coffee shop I worked at. I'd typically start about 5:30, and I'd work until about 2, 3, and then I'd study afterwards up until I had a bit more tutoring. Obviously, weekends, I sometimes worked, sometimes had to study, but it's all just about managing your time. So if you've got a plan for the week, you've just got to stick to it and work around, your commitments.
Absolutely, I 100% agree with you on that, because when I actually used to live in UK, I used to work at Penny Appeals as well. It was of course it was a full time job, and I used to go there. It was in Wakefield, from Dewsbury to Wakefield, all that traveling, coming back to Dewsbury, then of course working on my business as well. On top of that, going to gym. So definitely, once you're handling 2 to 3 different jobs or tasks at once, it definitely becomes hectic. But again, it comes back to the same thing. All these efforts that you're going to put in today, at the end of the day, which is going to be the next 5, 6 years, you're definitely going to see yourself and looking at, oh wow, I went through all of that path just to see where exactly I am today. So definitely, that journey is something is absolutely remarkable. So coming back to the foundation year in Darwin, right? So first year as a proper and a real dentist, what really surprised you the most?
I think the biggest thing that surprised me the most is the education around teeth in the public. You almost you almost expect people to know what to do and to have, like, better teeth. But I think I was in quite a high needs area, so people weren't very educated on, like, oral hygiene, how food can impact your diet, sorry, how food can impact your teeth, and like decay rate and things like that. And I think expectations of treatment outcome, I was a bit shocked at that as well. And I think one of the biggest factors as well was, obviously, you go from uni where you're seeing what, 2, 3 patients a day, to seeing 20. And I think that was a big adjustment as well for me to get used to pretty much
Mm.
overnight.
Yeah, absolutely. You see, my family has been in dentistry for the past 70 years. My grandfather, he ran his own practice for about 25 years, from 1993 till 2018, and eventually sold it. And I can tell you one single problem that has never changed in all that time, which is the food. You see, I have called hundreds of dental practices across the UK every single hour slot, whether that's morning, that's afternoon, or that's evening. And the receptionist says the same thing every single time. And every single time, 1 in 3 patient calls, they typically go unanswered, or they just simply go to the phone. And next day, your receptionist comes in, calls those patients back, and you come to know that they've already booked their appointment with another practice. I mean, ideally, you're paying for those patients, you're paying for those clicks if you're running paid ads. And those patients call your practice, nobody's there to pick up the phone, and they just simply ring the next practice on Google. I mean, this is exactly why we've built Maya. It's an AI voice receptionist for dental practice specifically. She picks up your calls 24/7, whether that's bank holidays, that's after hours, that's weekend, doesn't matter. She doesn't get sick. She picks up all the calls, books the patient straight into your diary, reschedules, cancels them accordingly. It's GDPR compliant. The data is stored in the UK, and you're also provided with every single call recording so you can track everything. So that is exactly why I would love to give you 14 days free trial on the house. You don't need any sort of card, no upfront payment. Just simply go to selenicai.com, SELENICAI.com. If your practice phone rings when nobody's there, Maya's already there to answer. Just book a call with me and I'll see if you're a perfect fit for it. Now back to the podcast. I mean, speaking about that, it does make me ask you one question. Is coffee bad for your teeth?
Only if you have sugar.
Really?
Well,
Wow.
if you put sugar, obviously that's going to increase your decay rate. But in terms of staining, just have a glass of water after and you'll be all right.
Okay, absolutely. There's one doctor named as Dr. Mustafa Mehta. He's in United States. He works in regenerative medicine, and he mentions one thing is just drink a lot of water before having any sort of coffee or caffeine intake. This is one trick to really get past this sort of health issues if you want to have a lot of coffee. Because there was a time, I'll tell you a thing, when I was building my two different companies around 1.5 years ago, I used to have about 8 cups of coffee every single day,
Oh, wow.
to the point my body just almost dehydrated, and I was just in a really chronic medical state. But currently, I've reduced all the way from 8 cups of coffee to 1 cup of coffee a day, just in the morning. Um, of course, after drinking a lot of water. But this is something, I definitely had questions. So if you have sugar in your coffee, or if you have any sort of sugary items, that's going to affect your teeth. Yeah.
Yes. Yeah.
Really? Okay, interesting. I was speaking to Dr. Alex Marquez the other day, and actually Dr. Hamza. We spoke about one thing is dental schools, right? So what's the thing that dental school just simply don't prepare you for?
Taxes. That's one straight up one. Especially kind of the difference between NHS and private incomes, limited company, not limited company. You don't get taught any of that. You just kind of have to find your own way. And I think almost the pressure of the job as well. You don't get taught how to deal with that pressure. Like I said, you see maybe 4 patients a day. There's no kind of rush to get things done. There's no, oh, I'm running 20 minutes behind, 30 minutes behind. I need to somehow catch up. Managing difficult patients, because typically if you're in an environment where you've got a tutor behind you and a patient's not happy, or something's gone wrong, the tutor intervenes and they kind of take over to make that patient happy again. You don't really tend to deal with the patients yourself at dental school. So I'd say like they're one of the three biggest pointers.
Okay, absolutely. I mean, taxes is definitely one of the biggest thing, is because this is my proposition. Is dental schools, they teach you how to become a great clinician, but they just never teach you how to become a practice owner one day. Because I mean, think about it, every other associate dentist out there, they definitely do have a dream to open up their own practice with their own vision, with their own creativity, where they can really show who exactly they are. So it's quite interesting. My ancestors, they have been the dentistry for the past 70 years. My grandfather, he ran his own practice for about 25 years, eventually sold it. And in regards to that, I've finally written my own book, The $2 Dentist. Why exactly brilliant dentists, they build broke practices. So definitely tax is one important aspect I would definitely add in the volume two. It's a good take that you've mentioned over here.
Yeah, definitely. It's one of the biggest things that they just don't teach you.
Sweet, perfect. Now I want to get to the heart of the podcast, and this is going to be a big one. It's going to be something that's really close to my heart as well. Why do you think patients bond with a person and not the practice?
I think at the end of the day, it's the person that's delivering the treatment. I know it's within a building, but they're almost trusting that one person to work on such like an intimate part of themselves in the mouth. And it all comes down to trust.
Yeah, absolutely. That surely does. So it comes back to the person, because since the dentist is going to be treating them, so they would like to have the intimate connection between both of the parties, the patient, of course, and the dentist as well. And if I believe the dentist, they can have some sort of a relation or build rapport with the patient, really. And I believe the patient just keeps on coming back just to most probably see the dentist as well. Um, and speaking about that, have you ever noticed, or when did you first notice a patient coming back for you specifically?
When they accidentally booked in with another dentist and they went to the desk and said, "Oh, why am I seeing them? I normally see like Dr. Dahlia." So they moved them back
Uh-huh.
over.
Wow. Have you ever asked them, like, is there anything specific that you like about my work, the way I deal with you and handle you?
No, I just tend to trust that patients like to come back to see me.
Absolutely. That's sweet. So you also started, documenting your work on Instagram. What made you, actually press post button for the first time?
It took me a long time. I think I was in my seventh month of my foundation year, and I thought I'll spend the first few months kind of building up my skills, getting, more confident in my work. But at first, I was like, it's just a portfolio for myself so I can keep track of my work, see where I'm improving. You should always take pictures of your work because you can kind of self criticize, you can see what can be done better next time. And then equally, it's also helpful for other dentists, whether you're a foundation dentist, whether you're an associate, to see other dental work.
Yeah, absolutely. I mean, it definitely builds up the portfolio. And for instance, I'm pretty sure that from 5 years or 10 years later, when you see all these past pictures and the work you've done, yeah, it would definitely give you the motivation. I have gone through that path, and it just feels really nostalgic, doesn't it?
Yeah. Even when I look back at my work now from foundation year, I'm like, wow, I've come a long way since then.
Yeah, 100%. So you do have about, I'd say, 20 posts up, but every clinical post is like watermarked Dr. Dahlia Brinklow. That's deliberate, isn't it?
Yeah, you want people to know that that's your work that you're putting out there, especially when you work within a practice, because my practice will always repost my pictures, and they'll always put my work on their social media. So if a patient sees, oh, I like that work, I like that composite bonding, I like that kind of filling, they know which dentist to go to get that work. So it's really
Mhm.
important to always trademark your work and and have your name on your posts and stuff.
All right, so quick one. Before we carry on, if you are a dental practice owner or you are a dentist and you've got a story worth telling, go to betweenpatients.online and I would love to have you on the show. And I'll personally get back to you with a date, time, and topic to discuss. Let's get back to the episode. Yes, absolutely. Trademarking your work is important. And and honestly, this is what I find really interesting. Even as an associate, not the owner, not the boss. You're building your own name early. Why do you think, Dr. Dahlia, that matters this soon?
It's all part of the career journey. I mean, sometimes, especially if you work within the same area, if you build that much rapport with a patient or that much trust with a patient, if you move practice, they'll likely move with you. Um, if it's within a close enough radius. And it's just about building, that image of yourself that you want to portray to your patients, to other practices. And I just think it's a really important part of the career.
All right, so quick one. Before we carry on, if you are a dental practice owner or you are a dentist and you've got a story worth telling, go to betweenpatients.online and I would love to have you on the show. So go to betweenpatients.online, make sure you apply, and I'll personally get back to you with a date, time, and topic to discuss. Let's get back to the episode. Right. Initially, once you started out, I mean, mentioned yourself, it took you about 7 months to really hit the Instagram post button. So the question really is, from your own experience, what do you think young dentists they typically get wrong about visibility out there?
I think sometimes they would feel like their work might not be good enough to put out there. They lack experience compared to other dentists. When in reality, your work, when you portray your work, it is almost for yourself as opposed to for other people as well. So you've just got to start as soon as you feel ready to, as soon as you feel comfortable to. But like I said before, the main thing that young dentists need to do is to take photos of their work.
Yeah, absolutely. Because the other day I was speaking to a couple of dentists out there in UK. I mean, they definitely had some good experience. They were doing a remarkable job out there on Instagram, showing about their work, Invisaligners, cosmetic, composite bonding, and all that. And I was like, "Would you want to come on the podcast? I would love to have you on the podcast." They were like, "No, I'm not. I'm young. I'm not that senior enough. I don't have that much experience and all that." So I believe it's something that's really important. Is some dentists they definitely do procrastinate and they don't value themselves about how much they should really value. I mean, you've spent 3 to 4 years learning the dentistry, and now you've spent about 5 years treating actual patients. It's almost 1 decade since you're in the dentistry space. So definitely, just believing in yourself is something that's important.
Yeah, exactly, 100%.
The other day I called you and you mentioned you do general, you do Invisalign, you do composite bonding and endo. That's a broad plate this early. How do you really decide what to lean into?
I think especially during your foundation year, you'll kind of find treatments that you enjoy doing. So, say I personally don't like doing dentures. It's not for me. I don't enjoy it. And every time I see a denture patient on my diary, my heart kind of sinks a bit. Um, Whereas if I see a crown prep or a filling or, even a root canal, I'm like, oh, okay, I'm excited to do this. And, I just enjoy the workflow a lot more. So that kind of steers you into which direction you want to go into almost.
Interesting. So, what is about dentures that you typically don't like?
I didn't feel like in uni it was taught very well, so I think I always struggled with it. And then, you never enjoy things that you struggle with. I really like the outcome for the patient, and obviously patients are happy when they get their teeth and they're very grateful and everything like that. So I do obviously enjoy that kind of side of it, but I just find it difficult. And I think that's why I don't enjoy it.
Okay, okay, makes sense. So, you mentioned you do like to do crown and composite bonding. So, what is about composite bonding and all these other treatments that lights you up?
I think especially with composite bonding or fillings, it's very arty, it's very creative. You're almost like creating a new smile for a patient. And like I mentioned before, I really enjoy working with my hands. I've got quite a creative kind of eye. So I do enjoy, that smile design and putting the composite on, making patient happy with it, secondary, tertiary anatomy, like all that kind of stuff. I do really enjoy doing that. And I think because, it's a bit of a longer appointment, I can really get into that workflow with a patient and, just focus on something for a good couple of hours.
Yeah, I believe when it comes to composite bonding, is something patients typically like this sort of treatment more rather than any other treatment is because the outcome they typically get, shiny, clear, white teeth is something I believe that definitely gets a lot of patients happy, doesn't it?
Yeah, exactly. They love it.
And I believe next year you are doing a diploma in aesthetics, and next year I believe you're doing a diploma in aesthetics and restorative. So why exactly that?
Like I mentioned, I enjoy the crowns. I enjoy the cosmetic side of treatment in dentistry, and I think a diploma is something that's good to boost your knowledge when it comes to occlusion, photo taking, how to manage patient expectations, how to communicate them. These are all things that are taught on a diploma. They'll also go into things like veneers and implant restorations and things like that. And I think it's just always good to keep learning. It's a job that needs constant learning, constant upkeep, and I think it's just the next step for me in my career.
Absolutely, absolutely. Definitely best of luck for that diploma, and
Thank you.
hopefully things can turn out quite nicely for you.
Thank you.
Let's do something interesting. Let's do a rapid fire session, shall we?
Okay.
Sure. So, was the pharmacy degree wasted?
I don't think it's wasted just because it taught me a lot about discipline. It taught me a lot about studying. It gave me a good background in medication, and they're all things that I've, took into my dentistry degree.
Sweet. And someone's 28 in a job they don't love, wondering, if it's too late to switch to dentistry. Is it too late?
It is never, ever, ever too late.
Why so?
Like I said, your career's for all the rest of your life almost. You're going to be doing it until you're about 60, 65, 70, or however long you want to work for. You've got to be happy in your career.
Absolutely. So, biggest worry people message you about is a age or, is a UCLan versus any other traditional 5 year school? Is there any sort of specific thing that people message you about?
I do get a lot of messages from people, in a similar position that I was in their undergrad degree and they're not enjoying it and the switch over to dentistry. And I always encourage them to make the switch because if you're messaging me in the first place, you're obviously thinking about it. You're thinking about it enough that you might apply. So I'll always encourage people to do it if that's what they actually want to do.
Okay. And if there was just one thing that you would tell yourself back when you were starting with dental school, what exactly would that be?
That it was the right choice, that, all my hard work has paid off. And alhamdulillah, I'm really happy in my job. I'm happy with the career I've chosen. And, it couldn't have worked out better.
Okay, sweet. And out of curiosity, are you Muslim?
Yes.
Wow,
Yeah.
I didn't expect that. Wow. Um, that's good to know. That
Yeah.
actually charms me up. I never knew that you were Muslim.
Yeah, I'm half Syrian.
When did you revert it?
I was born a Muslim. I've always been a
Oh,
Muslim.
really?
Yeah, yeah.
Wow, mashallah, that's great to know. Absolutely. Definitely, this is something I want to talk about. So, getting back to the podcast and getting back to the dentistry, to someone who's genuinely stuck in a career they don't love right now. So, what's the one thing you want to tell them?
I think if you're stuck in a career that you don't enjoy, you need to reflect and see why you don't enjoy it. What is it about the career that you don't enjoy? What are things you do enjoy? And can you either, navigate the career that you're in into a different industry that you might enjoy a bit more, or do you need a complete career change? If you do need that complete career change, how are you going to do it? What are you going to go into? There's a lot of questions that you need to ask yourself, and there's a lot of personal reflection that you need to do to see exactly what's right for you.
Yeah, I believe to kind of add something on top of that is something I have personally gone through that phase as well. Sometimes in life, you really zoomed in into the nitty gritty details of your work, your life, and day to day hectic stuff. So it's really important. You have to zoom out for a second and just reflect upon what exactly you're doing, just like Dahlia, you've mentioned. So I mean, think about it. There are two different perspectives. One is your current career that you're working on. You're definitely not the most happiest person, and it's the ideal career that you would really need. And just write a letter to yourself. It's one of the advice I've also given to my brother, who's starting up his own company as well. It's a Muslim matrimonial application named as Misa.app. But I told to him, if you want to make any sort of major decision in your life, just simply write why exactly do you think that X is not good for me, and just write why exactly do you think Y is good for me. I believe just writing that
Mhm.
gives you a satisfaction that you've written something on the paper. You've signed some sort of a actual agreement, though it isn't, but it just triggers the mind in the aspect of psychology. It triggers that you have to act upon this decision now. Does that make sense?
Yeah, you've put it out into existence. It's almost like manifestation. You've written it, you've got to achieve it now.
There you go. There you go. Absolute, Dr. Dali. It was a great podcast. And also tell everyone where exactly they can find you and follow your work.
So I'm at Harpers Dental in Bolton, and you can follow my work at Dr. Dahlia Brinklow on Instagram, I believe.
Perfect. Perfect. That's amazing. So make sure everyone you follow her and make sure you pass some great comments, ask her any sort of questions you've got, and she would be, I believe, more than happy to help you out in that process.
Absolutely.
Dahlia,
Absolutely.
thank you very much. Genuinely, that was brilliant. And, if you've enjoyed this, there are more episodes that are going to be coming out on Between Patients Online. You can go out there, apply to be a guest, and also make sure you grab the book, The $2 Dentist. It's again on Between Patients Online. So make sure you go and follow Dr. Dahlia. And that was pretty much it from my side. I'm your host, Muhammad Moiskuram, and this is Between Patients.